Okay, I think we can get started. Okay. Good afternoon, everyone. I'm Crystal Persida Sapienza. I'm ACA's Director of Provider Relations for Brooklyn and Queens. Welcome to ACA's and LifePlan's first Provider Relations webinar of 2026. Thank you so much for taking the time out of your busy schedules to share some of your afternoon with us. To ensure sound quality throughout the presentation, all attendees are muted without the ability to unmute themselves. If you're having trouble with your audio, please notify us in the email that was sent to you this morning. Please note that the chat and reaction features have been disabled for today's webinar. Again, should you have any questions, you can email myself or Anne in the email that was sent to you this morning. A recording of today's webinar and associated talking points will be posted on the Provider Relations page of both ACA and LifePlan's website in the upcoming weeks. Today's webinar will be Nick Cappoletti, CEO, presenting on key updates for Elevating 2026 for both ACA and LifePlan CCO. So without further ado, it is my pleasure to introduce Nick Cappoletti.
Thank you, Crystal. Good afternoon, everyone. Happy New Year. And thank you so much for taking time out of your busy schedules to join us this afternoon. We know the beginning of the year is hectic, lots of new initiatives going on. And we wanted to take this opportunity to kind of share with you some of our initiatives and some work that we've been working on over the last year. So again, thank you. You are valued partners. We share a common mission to help the people that we serve lead healthy, fulfilling, inclusive lives in our communities. Our job, our mission for ACA and LifePlan is to provide quality care management, making that as person-centered as possible and linking them to community resources, be it healthcare, long-term supports, community resources to help them lead those healthy, fulfilled, inclusive lives. And as a member or a parent of a member of LifePlan, I certainly appreciate what my care manager does for my son, but also what all of you do as providers. So we want to thank you again for the continued partnership and collaboration that you all show. Just talking a little bit about what we'll be doing in 2026. I'll get into some specifics in the agenda, but just wanted to share with you that, we've been building upon a lot of the work that we put in place when we created the two CCOs, when LifePlan and ACA joined together to create CCNY, which is a shared management services organization, to really make some significant investments in care management, in the quality of the training, the learning and development that we do, in the data that we provide care managers, in making sure that we have built upon the network of providers, both healthcare, long-term care, and community providers that our members need to be successful. We continue to do all of that. In 2026 is no exception. We're going to be sharing with you some of the work that we're doing, but in upcoming webinars, we'll share with you some of the additional investments we'll be making, and we'll actually be mentioning a couple of those soon. We're delighted to say that we have been making progress, though. One major investment is care manager learning and development. We continue to work on certification. All of our care managers will go through certification this year. That certification is based on their knowledge of key material, benefits, entitlements, connecting people to the right resources, certainly the standard care manager curriculum, but it's also based on their practice and an evaluation of their practice, as well as customer satisfaction. So we've been really in 2025 working on honing our ability to measure customer satisfaction. We've enhanced our survey to really to focus on person-centered questions about how the member feels about the life planning process, about our ability to link them to resources, about our responsiveness. And we've also been we've made some improvements in how we actually engage our members to do that member satisfaction. So that you're all aware, at the end of the life plan process, as soon as the care manager finalizes the life plan, the member is invited to take a survey. That survey is a dozen or so questions that solicit feedback on how the member feels about the process, the plan, the work that the care manager is doing, whether or not they're receiving the services they need. And then at the end of the day, at the end of the survey, given the opportunity to provide comments. So we are getting great response rates. And if the member doesn't respond within 30 days, the supervisor follows up with a phone call. They get the phone call regardless if the member completes the survey. The supervisor will thank them. If they have not completed the survey, the supervisor will remind them or give them the opportunity to do it online. And as a result of that, we've far exceeded the number of responses that we ever got in previous years. We are running a great response rate of roughly 20-25%. And the good news is that we're seeing phenomenal customer satisfaction, which is important to us and hopefully, is reflective of the work that we're doing. But we've seen, almost a 95% approval rate, and 9 out of 10 members are recommending us. So that's good. But we owe this also to you in the work that we're doing with you and your responsiveness in delivering the services that our members need. So we want to thank you for that. Let me just cover the agenda. Crystal, if you could advance the slide. I want to share with you some information that we're seeing that we think would be important to all of you as providers. First of all, we'll go over some member enrollment trends, what we're seeing our members need, talk a little bit about Medicaid recertification and some of the work that we're doing there to make sure that our members are continuously covered by Medicaid. There's no lapses, especially given some of the challenges associated with changes in federal legislation and also some of the challenges within New York. Talk a little bit about the collaboration agreements that we have in place with many of you and that we ask you to participate in. Share a little bit about how we are advancing care management, as well as providing access to our members about providers through the DSNY directory. We know CAS CANS is important to all of you, especially as OPWDD moves forward with acuity-based rates and making sure that our members' needs are reflected accurately in that. We obviously are going to be hearing in the next week the governor's state of the state. We've got conversations going on. There's been hearings with many of the committees on different topics. So we'll talk a little bit about our legislative agenda, talk about provider relations events in 2026, and then bring it to a close. So let's start with talking about some of the membership and enrollment trends that we're seeing. At both CCOs, we're seeing significant interest in enrolling in the OPWDD system, in getting a care manager, and ultimately in our members having services needs, unmet needs. ACA in particular saw tremendous growth in 2025, almost 9.5% growth, significant number of new enrollments. And you can see how that breaks down in age. A lot of people under the age of 18, a lot of children. We are seeing, just some statistics. How many people live in the certified settings right now? Roughly a quarter of our membership at both CCOs lives in certified settings, and about 3/4 of our population currently lives in the community. And that's important to note because with more and more people coming into the system, we are seeing the proportion of people who live in certified settings actually decrease, more people living in the community, and then also a large number of younger children. So while we have an aging population of those who have been in the system, we are seeing significant demand on the part of families who have young children. Right now, our enrollment pipeline, which is the number of people that are actually seeking eligibility and or enrollment in the CCO, ultimately services, is also fairly large. Just at ACA, we have over 10,000 people in the pipeline seeking enrollment, and at LifePlan, 1,700 people. You'll see the number of active deeming situations. While we have more people who ultimately need deeming, in deeming, for those who may not be aware of it, deeming is where the family does not qualify. The child is under the age of 18. The family does not qualify for Medicaid, but we are seeking getting that child an exception so that they can qualify for OPWDD services. So you'll see those numbers, again, significant demand. Not surprising, certainly given the fact that we are seeing a growth in the population. If we were to break this down and look at it by geography, at ACA, lots of demand or need in the metro area of New York City, as well as Long Island. In New York City, we see pretty significant demand, Brooklyn, Queens, the Bronx. LifePlan, primarily Hudson Valley, Lower Hudson Valley, Westchester. We are seeing most of the growth. So wanted to share that with you. And then if we look at this growth, what are they seeking? What are the services needs of our members? So if we could advance the slide, Crystal, we'll talk a little bit about that. These are the most commonly requested or needed services by our members. You'll see under the age of 17 or 18, a lot of the demand is for respite, giving those caregivers a break. Community hab for those individuals who are eligible, wanting to begin developing their skills, preparing for transition. We certainly see self-direction being the most requested service. Or way of receiving services. So a lot of people who are seeking respite, community hab, are doing so through self-direction. And then for those who are 18 and older, again, we see a lot of interest in what are the residential options. And I think it's important to point out for those of you who offer residential services that we currently have, out of our between ACANY and LifePlan, we have combined about 50,000 members, or a little bit over 50,000 members. And you will see that we have almost 15,000 who are living with aging caregivers. And those caregivers are looking for solutions. And they may or may not be on the CROW list, but they are looking for what happens when I can no longer care for my loved one. And this is a need that we've discussed with the commissioner, certainly brought up as part of the 507 planning process. Lots of people who are very concerned about what happens when they die. And collectively, the CCOs, we've even got more if you combine all of the numbers. So there's huge need for residential solutions, both certified as well as non-certified. Day programs, community habilitation, certainly self-direction remains very popular. And even though we do promote employment and we recognize New York as an employment first state, we don't necessarily see that demand reflected by our membership, but we are providing linkages where there are employment and certainly encouraging that as part of the person-centered planning process. So again, we look to you all to let us know what services you have capacity to provide. Share that with our provider relations team. If you have non-certified housing solutions, wraparound services, especially for those who maybe have more complex needs, we'd really like to learn about that. So please reach out to us. You could send any of our provider relations team an email. Reach out to Angie. Her email is here. But we're going to be trying to create a community of practice to meet some of the demand or identify models that may be working well, and hopefully replicating those models across the state. Because again, with over 14,000 people living with aging caregivers, we need to plan for that. We're not seeing an increase in certified opportunities, so we need to create collectively, in partnership with all of you, solutions that help address the needs of our members and their families as they get older and can no longer provide that support. Crystal, could you advance? Certainly, in order to provide any services, both care management as well as any of the waiver services or connecting people to healthcare, we need to make sure people maintain their Medicaid. We know this is an important issue for all of you who depend on our members having continuous Medicaid coverage. It's important to us as well. We are really working on new ways to support members when they get those packets, when they have to reapply, making sure that they're expecting those packets. So we start actually in our electronic health records, our care managers can see when people's Medicaid will expire. And we require our care managers to begin reaching out early. We are starting to send alerts 120 days in advance of those recertifications. We were doing it 90 days, but again, some cases we do find that people need more time. They might have received unexpected assets. There may be changes in who fills out that form. So we are starting to send out those alerts earlier. The care manager will continue to receive reminders until we detect that the Medicaid has been renewed. And we will see that in our system. We've done detailed trainings to all care managers, required them to go through benefits and entitlements training, testing. So again, we feel confident that our care managers can assist our members. We have a benefits and entitlements department that can assist care managers in those situations where a member may be being rejected or having more challenges in getting recertified, so that we can assist them in getting that person up and running on Medicaid, or if there is a lapse, to make sure that it gets closed. If a care manager cannot assist the member, supervisors are stepping in and are required to assist them. And as a result of all this, we are seeing a significant decrease in new lapses. And our goal is obviously no lapses, but where we do have lapses, to make sure that that lapse is short and that we get the person up and running, certainly before it results in any billing issues for either our providers, certainly impacting our members' ability to get the healthcare they need and impacting our ability as well. So wanted to share with you those efforts, and we'll continue to provide you with updates on that work. I'd like now to kind of shift, in Crystal, if you could advance to our collaboration agreements. Again, we are very intentionally trying to build these collaborative relationships. We started this over 7.5 years ago. Many of you have signed these agreements. Again, they're not a binding, but they do allow us to show that we've got this formalized partnership with all of you. We're extending this beyond the IDD community to also include the medical community, because again, we want to make sure that our members are connected to the services that they need, be it healthcare, community services, long-term supports through the waiver. We appreciate you all of you who have filled these out, and we would ask if you haven't to respond. If you have any questions, reach out to our provider relations team. We are using these collaboration agreements really to build awareness amongst our care managers of who provide services in the different geographies. Certainly with the growth that we're experiencing, that's important. With all the new care managers that we are hiring, we have hired several hundred care managers in the last year. We're continuing to recruit to both fuel our growth, but also to address those people who are leaving. I think we're very proud of the retention efforts that we put in place. We've got our current care manager turnover down to below industry averages. But again, with turnover, with new care managers, we need to make sure that they know who the providers are of services, both healthcare as well as long-term supports. And one of the ways we're doing that is with these collaboration agreements, which then feed the work that we're doing with our Disability Services New York site. So, Crystal, if you could advance the slide. For those of you who may not be aware, LifePlan started this several years ago and then extended it to both ACA as well as person-centered services. And this site is a comprehensive directory, online directory, the first statewide resource that gives people with IDD, the families, the care managers, all of you, access to information on who does provide services to the IDD population, be it healthcare, long-term support services, community services, recreation. It could be under a large number of categories. We built this site, we maintain this site. We want to ask you to make sure that the information is accurate. If you're not in there, we want to include you. We have, both reached out to many partners. We have pulled information from the life plans to basically populate this directory. So we want to make sure it's accurate. And we offer this to families. Members and families, we actually advertise it to them so that if they want to see what services are available, if they need a therapist, if they need ComHab, if they need PT, whatever the services that they need, they can look at this. They can then work with their care manager, and our care managers can use this when a member identifies a need. So we're going to continue to invest in this and update it. We also were successful in getting a CDC grant that actually helped us expand this, add accessibility data. So if you haven't visited the site, we encourage you to do so. Check out the listing that is there for your agency. Make sure it's accurate. If not, please click on this link. And this gives us the ability to really maintain, and I've shared this with Commissioner Bear, we now have a comprehensive statewide directory, and we want to make sure that it continues to be updated and we add to it. So again, we thank you for your participation and ask you, if you're not, to please consider joining us and being a part of this site. Crystal, if we could advance. The CAS and the CANS for children has been a hot topic since the CAS was initially introduced. And, I know both being a parent, being a provider, having been a OPWDD provider of long-term supports, everybody is very concerned about the CAS, the CANS. I think we all recognize and appreciate that we need a fair, equitable, transparent method of assessing people's needs. Certainly, we have multiple tools now. Some of them are very old. The DDP2 especially has been with us for, decades. So we need a better method of updating and assessing people's needs. That is becoming all more important as we see OPWDD starting to talk about moving away from the DDP2 and other tools to develop rates to assess people's needs and allocate services. So we are very much involved in ensuring that our members' needs are accurately reflected in our systems. We are working with many of you on that. I think it's important to note that, for care management, that Maximus, who actually is the state contracted entity who does the CAS CANS, that they do have access to our EHR systems. They can pull information. In addition, we are required to provide them with information when a member is assessed. So they not only get the information from us, but they have access to our systems for that period of time while they're doing the assessment. And we want to make sure that our information is accurate. We're working with all of you, but then also we are working together with multiple work groups to make sure that the tool itself is accurate and reflects the needs of those people we serve, both in those who may live in certified settings, but also those who live in the community. And having gone through this a couple times with my own son, we all have a vested interest in making sure that the tool works and that the information there. So we are doing trainings to our care managers. We are working with different work groups on how to improve the tool, educate members and families on the process, and make sure that everybody understands how we can work together in ensuring that each CAS assessment, each CANS assessment accurately reflects the member's needs. And if not, that we escalate it and ask for the changes that are needed. So we just wanted to share a little bit about that. Again, some of you are on the work groups that we are participating on or that we are actually hosting. CCOs have a couple of groups, including one that LIFEPlan and ACA are working with providers on. So again, stay tuned on all of this. But again, we have a vested interest in making sure that these assessments are accurate. Crystal, if you could advance. As we look to meet our members' individual needs, we also look at the issues that are affecting their collective needs. And something that, I always say to our care managers that while we serve 55,000 people and we have another 13,000 people that we are working with, our goal is to meet each individual's needs and do it in a person-centered way. But we also, as part of that, can start seeing the collective needs of people with IDD. And right now we have a little over 130,000 people with IDD in our system. The CCOs are working with almost 20,000 people in enrollment, 13,000 between ACA and LIFEPlan alone. So as we hear our members, we get input from our Member and Family Advisory Council. We get input through our different survey tools, our care managers, our forums that we were doing, the provider relation forums. We have been, collecting those needs and trying to ensure that the needs of our population are incorporated into both the 507 plan, the work that, certainly the governor's plan, and then also working with both the Senate and the Assembly subcommittees for IDD. We want our members to have a voice. We are encouraging that. We're working collectively with the CCOs on ways to ensure member agency, family agency, and identifying those areas that are of most important to our members. So with that, we're certainly going to be involved in a lot of the advocacy on the cost of living adjustment, any trends that even though it's a difficult fiscal year, we hear that every year. We want to make sure that not only are we advancing the needs of people in ensuring that we're getting adequate funding, but also on those areas of regulation, of legislation that affect our members' lives, that we are getting the attention and the action that we need. So we wanted to share with you this group, the formation of an advocacy work group. It's made up of self-advocates, family members, people who work in the system. We want to encourage people, again, to participate. We'll be sharing information with you on that. And as we do so, and we identify issues that are important, we'll be sharing that as well. Crystal, if you could advance, I want to share some specific legislative items that we are working on. And you'll see them here, and we can certainly give you more detail, but as a supporter of NIDA and their legislative priorities, we certainly are supporting the request for the 2.7% Care Force initiative. Will be in full attendance at the rallies that are coming up in the next several months in the legislative days. But we also want to talk a little bit about a few initiatives that are important to our members in providing them with the kinds of services that they need. You'll see here the first bill that focuses on training DSPs to allow them to perform health-related tasks, Medicaid administration. We need to broaden, there's a couple bills on this, broaden legislative or regulation authority or legislative authority to allow people to get the kind of supports they need in their homes, in the community, without necessarily needing a lot of nurse oversight. The Nurse Practices Act is somewhat restrictive for people with IDD. It doesn't give them the flexibility that they need, especially given the fact that we have 75% of our population living in the community. We're no longer, in an institutional model. Most people do not receive services in a certified setting. So we need to provide flexibility that allows people to receive the medication, the supports they need from their DSPs in their own homes without restriction. We still want people to be safe, but we can't have the kinds of restrictions that we are currently dealing with. The other thing that we are working on with Assemblymember Hevesy is allowing family members to receive or to actually be paid caregivers, to be able to reimburse them. We have adult siblings who may be guardians of people who are giving up their livelihood, their jobs to support their siblings, and they should be able to be employed through OPWDD services. So these are a couple of the legislative items that we have been working on and that we wanted to share with you and ask for your support on. And if you have more questions, certainly reach out to us and we'll have our team talk to you. But we have shared these with the other CCOs and are looking forward to getting support at the legislative level. Some of these actually came up in a recent assembly hearing where we know that Assemblymember Santa Barbara, along with the committee, was very interested in the issues that are preventing people from getting the kinds of supports they need in living in the community, especially when an aging caregiver is no longer able to care for the person. And these items were brought up. Crystal, if you could advance. I just want to talk a little bit about provider relations and some of the initiatives that we're going to be working on to support you all in 2026. We're going to continue our regional networking events. They have been hugely successful, and we appreciate your participation. We're expanding those events to family members, to members. We want to make them really an opportunity for networking. And we'll share a little bit about that attendance in the next slide. But in 2026, we're going to increase our focus in supporting self-direction, given that that is one of the major services that our members are seeking. Certainly want to engage independent brokers, fiscal intermediaries, in supporting them, in supporting our members. We are focusing on increasing access to healthcare. This is a major issue for our members in that, as you all know, we don't have enough providers of healthcare services to people with IDD. This is especially an issue for those who are seeking psychiatric services, those who are seeking dental services, but even other specialties in primary care. It can be challenging depending on the geography. So part of our work in our provider relations is really seeking more providers who are willing to provide support to people who who have Medicaid and Medicare. Right now, roughly 48% of our members have Medicare. Obviously all of our members have Medicaid. We are seeing challenges where providers cannot continue to provide the supports that we need because the reimbursement rates are not adequate. This is another legislative agenda that we've talked to both the Assembly and the Senate about, as well as the governor's office. So we are actively looking for any providers who will provide Medicaid and Medicare services to our members. We have our first summit that we are planning for people who have complex behavioral health needs. That's coming on March 5th. Stay tuned for more information. I think we've got some really good speakers lined up to address some of the challenges that we are seeing with our population who have comorbid both IDD as well as mental health issues, a major issue for many of our members. And then, like I said, we're going to be offering our regional networking events throughout the state. Just to recap what we were able to see in 2025, we offered, and Crystal, if you could advance the slide, 13 regional events. We saw a 300% increase in attendance. Thank you for all those who participated. This year, like I said, we began opening it up to members and families. We're seeing them show an interest. We also opened it up to lawmakers, their staff, because we want them to see the needs of our members. And you can see we had a couple of events that were very successful and very well attended in some of the geographies, and we're going to continue to advance these events and encourage attendance. So thank you for participating. I met many of you, many of your staff at these different events, and we know that based on the input we've gotten from both care managers, our members, families, they appreciated the attendance. And you can see how many care managers actually took time out of their schedules to come learn about the services that you all provide. We had great sponsorship from many of the providers who helped us put these events on, both financially, programmatically. So we want to thank you for doing that. That pretty much wraps up what we wanted to share in today's event. Having a WebEx, it makes it very difficult for us to really do live Q&A, but we do want to be able to respond to any questions you have about the information that we presented. We will do a recording of this, and as people either ask questions based on their attendance at the live event or the recorded event, those questions we'll make sure that we capture, that we respond to. So our team will be taking the questions, and you can email us at either of these emails. It's one team. And we look forward to any input you have, any future topics you want us to cover. Please let us know. We'd be more than happy to do that. I'm going to ask Crystal if I missed anything. Crystal?
No, you are great. Thank you so much, Nick. So this concludes today's webinar. Please join us. We have actually two great events coming up. So please join us on February 10th for My Choice Supplemental Needs Trust. It's an opportunity to learn more about the My Choice Supplemental Needs Trust. It helps individuals with disabilities to protect their assets while keeping Medicaid and SSI benefits. Plus, funds can be used for personal expense like hobbies, travel, and education. And as Nick mentioned, on Thursday, March 5th at 3 p.m., we are having a full day virtual summit on supporting people with complex needs. We have a wonderful lineup of knowledgeable clinicians who will be sharing a variety of ways IDD providers can support people with complex behavioral needs, including concrete, actionable, and practical next steps attendees can implement in their programs. The virtual summit is ideal for program administrators for both certified and non-certified settings, clinical and behavioral support, and medical and nursing staff. Thank you so much again, everyone, for joining. We hope you found this helpful.